Hi, welcome to the National Asthma Education and Prevention Program video number one. I'm Autumn Sanderson, and this is my video project for Respiratory 2480 Special Topics. The goals of the National Asthma Education and Prevention Program, also known as NAEPP, started in 1989, and it began so that we could address the growing health problem of asthma. This is a national problem. We see it a lot in our patients, especially here in Tennessee. It's a very significant problem, and according to the latest data, nearly 25 million people in the US, including 6 million children, have asthma. So, this is something that severely affects kids. And as somebody who's going into pediatrics, it's really important for me that we achieve these goals that the NAEPPCC has put forth. The National Asthma Education and Prevention Program Continuing Committee provides a venue for convening diverse stakeholders with an interest in improving asthma management in the context of current standards of care. So, what are our goals? We want to raise awareness among our patients, healthcare providers, and the public so that we know how serious this condition is. We also want to ensure the recognition of signs and symptoms. We want to make sure our patients know what their signs and symptoms are, what their families know that the signs and symptoms are, and the public, so that we can appropriately diagnose these asthma patients. And we also want to ensure effective control of asthma by encouraging a partnership with patients, physicians, and other healthcare professionals through modern treatment and education programs. We also want to enhance the quality of life for patients with asthma. This is a debilitating, at times, illness. So we want to make sure that they have the proper tools and education so that they can live life to the fullest and reduce the burden of asthma and also reduce the number of asthma related deaths. So, to accomplish all of this, the National Asthma Education and Prevention Program Committee oversees the development of asthma guidelines. They also create tools and materials so that we can put these guidelines into practice, not only in the hospital, but also out in the community. They also coordinate federal asthma related activities, build partnerships, and so on. The membership of their committee is a federal asthma advisory committee, and this compromises of representatives from federal agencies, medical associations, voluntary health organizations, and community programs. And the goal of that is to educate patients, educate the public, and educate health professionals such as physicians, nurses, respiratory therapists, and so on. At a glance, their expert panel has developed clinical guidelines, and we know these to be the expert panel report 3 for the diagnosis and management of asthma. And selected topics in this report for the diagnosis and management of asthma were last updated in 2020, so not that long ago. That's great for us. Some resources. They first developed and widely disseminated the guidelines for diagnosing and managing asthma in 91. They made revisions in 97, 02, 07, and as of recent 2020. And the most recent update, which I have linked here, the 2020 focus updates to the asthma management guidelines, it gives guidance on 6 selected topic areas. Their former control initiative engaged diverse stakeholders to bring asthma care in line with evidence based recommendations. And so the NAEPP, along with the National Asthma Control Initiative, resources for patients with asthma and their families. And they also have resources for healthcare professionals, and those are still available. So, quick asthma care reference guide. This is a great tool that healthcare providers can use to provide quality care for those who have asthma. It's quick and it outlines everything really great. So, quality asthma care involves not only the initial diagnosis, but also the treatment so that we can control asthma, not just short term, but also long term. And this also includes regular follow up care so we can make sure that our patients really have proper control over their chronic illness. So this focuses on two different domains. We want to reduce the impairment, and we also want to reduce the risk. Management and diagnostics. The expert panel report 3 guidelines for diagnosis and management of asthma. This is a set of national guidelines to emphasize the importance of asthma control. And this includes reduction of environmental asthma triggers and approaches for monitoring asthma. So in this panel report, they focus on quality asthma care, the control environmental triggers, so such as smoke inhalation, pollution inhalation, and so on. Pharmacologic therapy, such as our different medications that we're going to use, whether that be our SABAs, our LABAs, our corticosteroids. Patient education, not only educating the patient on their illness, but also how they can better manage it, whether that be making sure that they know how to properly use their MDI and their spacer, or how they can limit asthma exacerbations following exercise, and so on. And also regular follow ups with their healthcare provider. That's going to be really important to make sure that the patient is doing well with their asthma treatment plan, and we can make any adjustments if needed. Asthma control focuses on reducing impairment and reducing risk, which we touched on earlier, but also measuring the control of the illness. And it's also going to focus on working closely with healthcare professionals, whether that be physicians, nurses, respiratory therapists, and so on. And it's also going to focus on adjusting the patient's care plan as needed, as previously mentioned. Maintaining control. We want to assess the patient as well as their signs and symptoms, and we're going to monitor those to make sure that they are improving and not getting any worse. We also want to control their asthma control plan, and this could look different from time to time for a patient. It's really patient specific, so that's why it's so important that patients are going to those follow-up appointments so that we can make sure that their plan fits their needs. Environmental control, which we kind of touched on earlier as well, that involving pollution outside, smoke inhalation. Medication control, making sure that the patient is on the correct and best medications for them so that we can limit the number of exacerbations. Regular follow-up care. Medication adherence, again, making sure that the patient is taking their medications properly and using the correct technique. Patient education and management. It's really important that the patient is aware of their signs and symptoms, as well as how to properly use the tools and medications given to them by their providers. And treatment flexibility. So, for the patient's initial visit, this is the timeline that we're going to look at. So, first, we're going to officially diagnose the asthma, and this is going to include measuring the patient's lung function. Sometimes patients will have a spirometry done or a methacholine challenge performed, but patients will likely have some severe symptoms, including shortness of breath, tightness in the chest, worsening symptoms at night. We are going to assess the asthma severity after we have it diagnosed. This is going to tell us how severe the asthma is, and then that's later going to help us initiate medication and demonstration use. So, knowing how severe the asthma is tells us what sort of medications they need to be on. Typically, patients are going to have their SABA, but do they need a LABA? Do they need something more long acting? Do they need an inhaled corticosteroid? After we have our medication and demonstration use initiated, we will then develop a written asthma action plan. This is important for the patient to have written down so that they don't forget, and also that they can have people in their life who are also aware of their asthma action plan. And then we want to schedule a follow up appointment with the physician to make sure that all of these steps that we just taken are accurate. We want to monitor these signs and symptoms and the severity, as well as see how the patient is doing with their medications. Is something working? Do we need to change something? Or can we just continue these follow up appointments and limit exacerbations and prevent hospital stays, even death? So, our follow up visits look a little bit like this. We will assess and monitor the asthma control. We will review medication technique and adherence. Sometimes that might even look like using a spacer, making sure that the patient knows how to use their spacer, um, as well as knows how to use their peak flow device so that they can measure those peak flows every day. We will assess their side effects to the medication and their other therapies, and we will also review their environmental control. We want to make sure that our patients aren't smoking. We want to make sure that they're not in an environment where they might be at risk of having more exacerbations. We will then maintain and step up or step down the medication. We will review the asthma action plan and revise it as needed, and then schedule the next follow up appointment, and the cycle continues. So every follow up will look a little bit like this. And here are my citations for video 1.